24, Fox 66, YourErie.com special report.
Good afternoon. We interrupt our programming to bring you a special report, an update on COVID-19 in Erie County and the status of vaccinations. Special guest with Erie County Executive Kathy Dahlkemper today will be Melissa Lyon, Director of the Erie County Health Department, and Dr. Andrea Jeffress, a local OBGYN. Let's go to the studios of WQLN.
Great to be with you again. Obviously, it feels like home to me back here at the WQLN studios, and I thank you for joining me as we give you an update on COVID-19 here in Erie County. Today, we have 5 new positive cases of COVID-19 to report within the county. While our case numbers have been low recently, it's important to stay vigilant in order to protect our entire community from the spread of COVID-19. Controlling the variants, specifically the Delta variant, has been challenging in certain regions of our country, and we want to be prepared if it, or when it, I should say, inevitably shows up here in Erie County. Our best line of defense is to ensure everyone who is eligible gets vaccinated. The 3 most recent deaths that we have reported here in Erie County have been people in their 30s, their 40s, and their 60s. So as you can see, this virus continues to be deadly, and deadly to often younger individuals. Governor Tom Wolf has announced the masking mandate will end on June 28th, next Monday. It's still recommended, though, that all unvaccinated people wear a mask when in public settings or when social distancing cannot be achieved with people who live outside of your home. Once the masking mandate is lifted, specific locations, such as medical establishments, will continue to require you to wear your mask whether you are vaccinated or unvaccinated. Additionally, any business can set stricter guidelines for their customers who enter their establishments. It's important that all of us respect these individual decisions and show kindness to those who continue to require masks, as well as those who continue to decide that they want to wear a mask whether they are vaccinated or not. Just this past weekend in church, I wore my mask because I was around many people with no knowledge whether they were vaccinated or not. My grandchildren were all with me. They are not vaccinated because they are too young, and they wore masks, and so I also wanted to wear a mask to be in solidarity with them. So please remember that people have the individual ability to make a decision as to whether they wear that mask or not, and please respect them for that decision. Currently, about 50% of the eligible Erie County residents are partially vaccinated, which means they've had at least 1 shot. But the likelihood of coming into contact with someone who's unvaccinated, that other 43%, is still extremely high in Erie County. Vaccines have proven to be safe, and they have proven to work at keeping the COVID-19 rate down here in Erie County, and certainly to keep people from getting the severe effects of COVID-19, including hospitalization and death. Vaccinations are available to all people 12 and over, and the COVID vaccine is absolutely free to everyone. No health insurance is needed to get a vaccine. They are also readily available. Up-to-date information about vaccination sites can be found at vaccines.gov or on our county website, eriecountypa.gov. There's going to be an upcoming mobile vaccination clinic on July 9th at Lavery Brewery down at 12th Street between Peach and Sassafras. A big thank you to that private business for doing their part in encouraging people to become vaccinated. And a big thank you to the Erie County Department of Health and those who are assisting us in making these mobile vaccination clinics possible. Our Department of Health is working hard to bring forward, again, the information, the education, as well as accessibility for both testing and vaccines to all members of Erie County's community. I would now like to turn it over to Melissa Lyon, the Director of the Erie County Department of Health, to give us an update from the Health Department. Melissa?
Thank you, County Executive. It's always a pleasure to join you on these press conferences. Today's topics are focused on quarantine and isolation, vaccine availability and the impact to the community, as well as new emerging COVID variants. While vaccines for COVID-19 are now widely available and masking will no longer be required by the governor starting June 28th, the Erie County Department of Health reminds our community that public health relies on all of our efforts to keep each other safe and healthy. So, in order to protect our unvaccinated community members, testing, isolation, and quarantine are still very important. If you test positive for COVID-19, even if you do not have symptoms or only have mild symptoms, you can pass on the coronavirus to unvaccinated loved ones, friends, coworkers, and acquaintances, and they could become sick with COVID-19. Isolation and quarantine are long-standing, proven public health methods that prevent the spread of infectious diseases. These methods are not related to the governor's orders. Therefore, they are not being lifted on June 28th. We will continue to require isolation and quarantine. We have always used these methods to control infectious diseases, some as common as the flu, and for other diseases such as measles, chickenpox, and even tuberculosis. Isolation means no or very little contact with anyone in your household. If you do test positive, isolate for a minimum of 10 days, and you must have no fever for 24 hours at the last day without using fever-reducing medication. Quarantining means no or very little contact with anyone outside the same living space. If you are unvaccinated and have been in close contact with someone who tests positive, you must quarantine for a minimum of 10 days, and potentially longer if you live with the person who has tested positive. Close contact can mean 6 feet or closer for 15 minutes or longer. This would also include hugging or kissing and even sharing eating utensils. With our combined efforts, just as we did with other vaccine-preventable diseases like polio, measles, and chickenpox, we can control this vaccine-preventable disease and we can save lives. On the bright side, if you are fully vaccinated and you are identified as a close contact to a COVID-19 positive individual, you will not be required to quarantine if you are not exhibiting COVID-like symptoms, also referred to as asymptomatic. You would need to demonstrate proof of vaccination, and then you will just be required to monitor your symptoms in the rare instance that you do become ill. Therefore, vaccinations provide additional opportunity to resume normal day-to-day activities without interruptions of mandatory quarantine if you are exposed to COVID-19. It's important to mention or reiterate that the CDC continues to endorse that masking prevents the spread of respiratory illnesses, such as COVID-19, and that unvaccinated persons should continue to wear a mask to protect themselves and others from becoming infected with COVID-19. There are many COVID-19 variants circulating in the world. Many of these variants are more transmissible and are infecting unvaccinated people at alarming rates. Of greatest concern recently is the Delta variant. It is only a matter of time before this variant begins to show up in our community. So please, if you are unvaccinated, continue to wear your mask to protect yourself from this variant. And consider getting a vaccine soon. As you've heard, you can find vaccine locations by visiting the website vaccines.gov. You can text your zip code to 438-829, or you can call 1-800-232-0233. If you do become ill with COVID-like symptoms, please consider getting tested. Our mobile unit is offering free testing this week, June 24th, Thursday, 4 to 8 p.m., General McLean High School, Edinboro Road in Edinboro. June 26th, Saturday, 10 a.m. to 2 p.m. at the Blasco Memorial Library on East Front Street in Erie. They are free opportunities to become tested. You may also visit eriecountypa.gov, click on the COVID banner, and then click on testing to see a full listing of testing locations in our community. In closing, I ask that you all be kind to one another regardless of people's individual preference to wear a mask. As the county executive shared her story, I thought I would share mine. I am fully vaccinated and I continue to wear a mask in certain situations where I am more comfortable doing so. I have family members that are immune compromised, and I want to be overly cautious of my potential exposure to high-risk settings, such as large public gatherings. So always, please remember to be kind. Back to you, County Executive, and thank you.
Thank you, Director Lyon. And as Melissa said, COVID-19 is now a vaccine-preventable disease. But we understand that there is a lot of questions about vaccination safety, specifically amongst women of childbearing age, and specifically women that soon want to be pregnant or are pregnant. So with us today, I'm really pleased to have Dr. Andrea Jeffress from the OB-GYN Associates of Erie to provide some clarification about this population specifically and the COVID-19. Dr. Jeffress.
Good afternoon, everyone. Thank you, County Executive Dahl-Kemper. Thanks for having me. And thank you to Director Lyons for that wonderful update. I am a board-certified OBGYN. I've been in practice at OBGYN Associates for 21 years and in practice for 25 years. And I would say, as an obstetrician gynecologist, this has been one of the scariest times in my career, in working, but I'm full of hope now because, yes, COVID-19 is a vaccine preventable disease. And I'm here today to give our region some hope and some encouragement for the pregnant women in the area that it is safe to get vaccinated. The American College of Obstetrics and Gynecology, ACOG, and the Society of Maternal Fetal Medicine have both put out statements that have debunked a lot of the myths surrounding the vaccine uptake in pregnant or childbearing women. And so we really would like people to be aware of these updates, that it is safe to get vaccinated in pregnancy, and even if you're not pregnant. There are no studies that have shown that it can affect fertility. And one of the resources that I like to give my patients who come to the office and ask me that question, because more and more people are coming in to ask these questions, is I direct them directly to the maternal fetal medicine site. It's smfm.org. And you go to the recent news tab and you drop down to clinical guidance. And then under the clinical guidance section, there's a line that says COVID-19 publications. And then you can go to the provider updates and recommendations page. And so if you have any concerns and you feel like you need more support, to look and to see for yourself that it's safe. Now, I would say the benefits outweigh the risks, because as in anything, you can take any kind of medication that we normally would take. And yes, there could be risk. But at this point, when you see a pregnant mother on a ventilator, and she's having trouble breathing, and she's critical, and she's very pregnant, and the C-section crash cart is sitting right next to the bed. It gives you pause, and you understand the gravity of the situation. And we've faced that several times this year, just at the two hospitals that I practice at. We go to both major healthcare systems, and then LECOM also has inpatients as well, but the majority of them go to AHN or Hammett. And it is really critical when you see the mothers struggling to breathe. And if you've had any family member affected, you know that you want to keep them safe. I, as a healthcare worker and physician, I have been vaccinated. My family has been vaccinated. My son plays basketball. He is at the University of Pittsburgh, and he got COVID-19 this year, and it could be a little scary there. So I think we all have our stories, and we all want to keep our loved ones safe. So I just wanted to, give some encouragement that it is okay and it's safe to be vaccinated as a pregnant woman and as a childbearing woman. And also, there have been also some studies that have conveyed passive immunity when a pregnant mother develops antibodies, that those antibodies can cross the placenta and protect the newborn child. And so that is, we've seen that passive immunity when you come in and get your Tdap vaccines at your 28-week visit. When you get your diabetes screening, that's very common because whooping cough was killing a lot of children. And in the same vein, we can vaccinate against COVID-19 in pregnancy. So I just wanted to convey those thoughts to our community. And I understand the resistance that people feel, but I think when you think about all of the major illnesses that have been plagued in our lifetimes and in our generations, modern science has given us a way to really help combat illness, pathogens that we can come across as humans. And so I think that we should, take the fact that benefits do outweigh the risks, and we should try to get vaccinated. So thank you for having me today.
Thank you so much, Dr. Jeffress. I have to say, when you spoke of the mother who is struggling to breathe and the crash cart for a C-section is right next to her, it truly gave me chills. And so thank you for the work that you and all your colleagues are doing to help our moms and our babies. And with that, I'm going to turn it over to the media at this point for questions for either Director Lyon, Dr. Jeffress, or myself. And as we normally do, we'll first turn to one of our great media partners, and today we'll go first to Talk Erie. Joel, are you with us?
Yes, thank you, County Executive. I do have a question for Melissa Lyon. And Melissa, thanks so much for taking this question. Is the Health Department doing any surveys to find out why people are not getting vaccinated? We were kind of taken aback that even Community Health Net doing an event on the Juneteenth celebration yielded just 2 actual vaccinations, according to Jim Martin's reporting in the paper. What are the verbatims that are being presented as to why people are resisting the vaccination?
Thank you, Joel, and it's always a pleasure to be on to answer these questions. We have not done a formal survey of the community inquiring their reasoning for not receiving vaccine. What we have run into, and one of the reasons that we had Dr. Jeffress with us today, is still remaining to be trusting of the vaccine, also weighing the benefits and risks. There are many individuals that anecdotally have been reporting that they don't feel that they're at great risk for getting COVID, or if they are, they don't and believe that they will become ill, or they're less likely to become severely ill, which is why our messaging today was talking about being able to prevent the spread of disease to others that we care about, that we love, our family members, our coworkers, our acquaintances, to sort of frame the message in a way that was letting them understand the greater protection that they can provide by becoming vaccinated. So the short answer to your question is we've not done formal surveys, but we have anecdotal reports when we're in the community, when we ask if individuals would like to have a vaccine. We're going to continue to offer vaccines at the mobile unit in conjunction with the events that are happening and other areas in the community that have invited us to come and provide vaccine. And we'll continue to put very well-informed individuals at those events to answer questions. So we're really willing to spend time with each person to answer as many questions as possible, hopefully have them change their mind to receive a vaccine, or give them additional resources that they can have as takeaways to do some additional research that's trustworthy information so that they can make a better informed decision. Thank you for letting me give you that long explanation.
Just a quick follow-up then. Early on, we did the door-to-door to issue the information into the urban core. Does this deserve another round of information distribution?
we are working directly with the community centers. That was also our partners in the past when we had done that type of effort. And so I'll be honest, we probably spent a ton of time in the beginning talking about how we were going to get vaccine to everyone that wanted that. And we are beginning, but then we had to take our resources and put it towards having the vaccine mobile unit be ready to roll. So I think we're exactly getting to that place. Now, how are we promoting it? How are we going to get out into the community? And I wouldn't say that door-to-door is off of the table. I think door-to-door is definitely something that we're considering. It just becomes resource intensive, and we need additional partners to assist with that. Thanks, Joel.
Thank you.
Thank you, Joel. We'll now turn to Erie News Now.
Good afternoon. A question for Director Lyon. Director, we've seen case counts in Erie County dip precipitously over the last handful of weeks, single digits now for a handful of weeks. Any reason to think that we're not, if not out of the woods, at least running toward the clearing?
Thanks for the question, and I have been very pleased with the single-digit case reports that we've been able to provide. I have a couple of reservations to think we're out of the woods, mostly because as a public health practitioner, it is absolutely my responsibility to be informed of what's happening across the country and across the world. And so therefore, I did speak of the Delta variant today because it is so transmissible and it's impacting our unvaccinated populations in other parts of the world that it is concerning here for Erie County. As you heard, we have just over 50% of those that are eligible vaccinated. So we still have a large portion of our population that is still at risk. So I have to be cautiously optimistic, though I'm not afraid to celebrate those low case counts right now. And that's why I will continue to monitor what's happening around the world and then watching what we see here locally. The other piece is why we talked about testing today is really encouraging people to get tested if they have symptoms or if they think they may have been an exposure or even in an event that could have been high risk. And an event that is high risk is also large gathering size because it's clear to determine that you don't know who was vaccinated, who was unvaccinated, and with the masking orders being removed, there's an increased risk. So testing, very important, and as your public health director, I will do my due diligence to watch what's happening across the country and the world. Thank you.
Director, speaking of testing, we see these single-digit case counts. How much do you think of that is due to a legitimate, just big drop in cases, and how much is it a hesitancy on people's parts to get tested?
I think it's a combination of the two. So testing is readily accessible. So there are basically zero or very low barriers to getting testing at this point. I think that the cases that we're seeing have been, there's been a drop in testing. There's also been mild symptoms. And with that, we're just not getting as many cases. But I also do believe we are trending down with our case counts. So according to Dr. Nadworny, the sewage results do reflect that our overall case count has declined significantly. So it will continue to do the great work that everyone's been doing around vaccination, isolating and quarantine, getting testing, and keep those case counts low. Thank you.
Thanks.
Thank you. We'll go to Erie Times News. David, are you with us? Or is there someone else from Erie Times News? Okay, we'll move on to Jet TV.
Hi, this is Julia Hazel, Jet 24 News. My question is for Director Lyons. I really just had great information from what I heard from the doctor just speaking about how safe the vaccine is for a pregnant woman. I just wanted to know if there was any more studies to show any more, like debunking any more myths or anything else that we need to know to inform the public with.
It was a little difficult to hear the full question, so I'm going to reiterate that you were pleased with the information that you had received from Dr. Jeffress around pregnancies, but then studies around others, or is it still related to pregnant women and women of childbearing age?
Just any extra studies really just to show the public if the vaccine is safe or any more myths that are being heard around.
I'm going to ask Dr. Jeffress if she wouldn't mind answering this question, if she knows of additional studies that demonstrate safety and efficacy for vaccine of all persons.
Hi, yes, thanks for the question. I would again refer you back to the Society of Maternal and Fetal Medicine.org. Under their publications area, where that drop down is for the COVID-19 and then publications, they have compiled updates. And so you'll get most of your answer to your question for any studies that you want to, see that have proven or supported their claim that the vaccine is safe, and debunk some of those myths, like it will cause infertility in the future if you haven't had children yet and you're of childbearing age and you get it. It will debunk that myth. So you just refer back to the Society of Maternal Fetal Medicine.org, FM, and .org, and I would definitely look under there for the publications, because much of what your question is answering you could get there as far as any additional updates. And you can also see they've updated that since December. You'll see each time that they've updated it, things that they've added. So I think it started maybe December 1st or December 15th, and then you'll see the update, I think, in March, and then an update in April. And then the last update is April, I want to say the end of April. So you can see the progression of the studies that they've added on that website.
Wonderful. Thank you so much. One more question for Director Lyons. Speaking just from what some of the other reporters had asked previously, what's the come for the future in terms of just trying to find out why some people aren't getting vaccinated? Or is there any progressions to work towards getting a study done for the reason why?
I think it's complicated. There's no one size fits all as why people are not choosing to be vaccinated at this time. I would say it's a combination of some of its time and convenience, so they've not prioritized it. Also, I had mentioned the risk benefit, so they're seeing that the risk is greater than the actual benefit as they've done their analysis, as well that there is concerns about side effects, missing work, and then there are a number, I think, of unproven myths that just continue to circulate within our community, whether it's through social media or unreliable sources. We do have frequently asked question documents on our website in the vaccine section. We've tried to answer as many questions as we thought might get answered. And then there's also the Public Health Collaborative Communications website, and there's a lot of information there. I can't say that it's actually any one thing. So we're always willing to talk with individuals and families to help them feel more comfortable in their decision making. And then we also encourage them to talk to their primary care provider, because they need to find that person that they trust and will give them reliable information, and they have a history of giving them reliable information in their health choices. So we will also refer there for individuals. And so I know it's really complicated, and we expected this to happen in public health. I don't think we expected it to happen this soon, and I also don't think we expected it to happen with this many people. So with that being said, we're still sort of navigating our next steps, and we're not unusual here in Erie County. This is happening all across the country. Thank you for the question.
Thank you. I appreciate it. Thank you all.
Thank you. And we're going to go back now to Joel at Talk Erie.
Thank you, County Executive. I do have a question for Dr. Jeffress. Doctor, in your expert opinion, as you look at the pregnant women that had bad cases of COVID over the last 18 months, how many would you say had some other underlying health condition, whether it's gestational diabetes, obesity, etc.?
Well, that would be hard to know without having exact numbers in the region. I know for our group, we keep a running list. I think we have about 140 women on our high-risk list. And we live in a region where we tend to be a little bit overweight. And so that's always a comorbidity in itself. And pregnancy is a comorbidity in itself because the physiologic changes in pregnancy make it, difficult to deal with respiratory issues when it occurs. So, and also pregnant women are more prone to blood clotting. And we know that COVID-19 causes more clotting issues. So we've had several COVID-19 pregnant mothers with blood clots. We've had several COVID-19 patients with pneumonia. Some, not all, have required intensive care unit care. But many have required oxygen on the floor, so much to the effect that we have to go to one-on-one nursing just to observe the patients and make sure that we are monitoring their O2 sets, and so transferring them to the appropriate floor, whether it be the step-down intensive care unit or the full intensive care unit. In those cases. So I think because of the obesity, because of the gestational diabetes, because of pregnancy as it's in itself, putting patients at higher risk for blood clotting and really more grave situations in terms of when your oxygen drops, then the baby sees less oxygen, and so we've had more abnormal fetal heart rate patterns that require emergent C-sections, and then that puts the mother at risk because oftentimes if we can't do spinal anesthesia, we have to put them to sleep and do general anesthesia, and that gets that gets troublesome because then, naturally you're intubating someone who's already at risk, high risk for pneumonia. I think it goes a long way to say pregnancy in itself is already a high risk state for COVID-19. So when you put on top of that our overweight or diabetes or hypertension, chronic hypertension, preeclampsia, these are problems that are causing us to see more critical care situations in the pregnant women, which is why we really need to debunk the myths about lack of fertility or loss of fertility or miscarriage. That's another myth that needs to be debunked and has been debunked. So I think if we debunk those myths and people get more comfortable with the safety of it. Now that thousands of pregnant women in the United States have been vaccinated, I was hoping that more pregnant people would see that and opt to get vaccinated, but it is still a slow uptake. Now, the Minority Community Investment Coalition and the four community centers in the area, Booker T. Washington Center, Martin Luther King Center, Urban Erie Quality of Life Learning Center, and the John F. Kennedy Center, they are continuing to run programs through the healthcare workers to disseminate and raise awareness, disseminate information and raise awareness about the vaccination process. And also they continue to do testing at their sites. And sometimes, although the testing numbers have fallen way down, it is still really convenient. Like every week, maybe a big family comes and they can all get tested at the same time. And they can all then determine, who's positive, who's negative, and how to isolate. And I think that's making a big, big difference. So I think getting the word out through the community centers may help with, not just getting the word out to pregnant people, but just the community and the inner city community in general. So I hope that helps answer that question.
Very helpful. Thank you, Doc.
Thank you, Joel. We'll go back now to Erie News Now. Ethan.
Hi, a question for either County Executive Dahlkemper or Director Lyon. What do you see as the biggest impediments to increasing vaccination rates throughout the county, and what specific steps has the county or is the county going to take to combat those impediments and try to up vaccination rates?
Well, I do believe one of the impediments just has been convenience. You know, people have to work, they've got lots of things going on in their life, and particularly if they live in some of the more rural areas of our community, it can be a little more burdensome for them to find a vaccination location. And so a couple things. One, this has been done really through the state government and the federal government of contracts made with a lot of the pharmacies, so a lot of the national chains, some of the grocery stores, so that helps to increase the number of places where you can get a vaccine. But what we've done specifically in Erie County government is our mobile unit, and it is out doing mobile testing, but now it's going to start going out to do mobile vaccination clinics, and that will be, I think, helpful, particularly as we are able to reach some of those areas where there aren't as many options in terms of getting a vaccine, and also going to the events where people are already at. So we make it extremely convenient for them to get that vaccine.
Are there any plans to go to any specific events? Can you name some that they plan to take the mobile unit to?
Let me ask Director Lyon what her team is looking at.
Thank you. So we also work with our healthcare partners to make sure that we're covering as many events as possible. So for example, 8 Great Tuesdays was an event that was proposed to us, and then it looks as if AHN is going to be covering the vaccinations for 8 Great Tuesdays. So we are trying to coordinate so we're not duplicating efforts. I'm trying to think an example that we were going to. There will be a list, I know that much, it'll be the end of July. So there's a cleanup, and I think it's a city cleanup, and it's happening quite widely from the east side to the west side, and we're planning to have the unit available there. We've talked about fairs in the future. So we're looking to what that can be. Right now, we're handling a lot of the special requests. So Lake City wanting something out that way with their fire department, we're going that direction. So stay tuned as we have a much more robust schedule. Our social media is really promoting those things pretty heavily. So I encourage everyone to watch our Facebook page as well as our Twitter feed to find that information pretty quickly. Thanks, Ethan.
Thanks.
Thank you. And now we'll go to Jet TV, and I think it was Julia, maybe?
Yes, I think we've covered all the questions that we have, but thank you all so much for your time.
Okay, thank you. And we'll go back and see if Joel has a final question.
I just have a quick one for you, County Executive. In looking at the state vaccination rates, Erie County is significantly lower than a lot of our peer counties. Not by a lot, but by some. Do you have any thoughts about all that?
You know, again, I think it's a multifaceted reason, but if you look at the surrounding counties to us, their vaccination rates are much, much lower. And so I think it just maybe goes to people's, sometimes to their political affiliation, sometimes to other just beliefs that are just different than maybe some of the people who are in more of the urban population. But that's anecdotal, and I don't really have the research behind that. But I think there's just a hesitancy by some to get the vaccine and the reasons are multiple. And one of the other reasons we haven't really discussed, but I have heard this, there are people who believe because they had COVID-19, they don't need to get the vaccine. And yet we know if they've had COVID-19 and they get the vaccine, their protection will be that much greater, probably for a much longer period of time, is what the studies seem to be showing. So it's encouraged that even if you've had COVID, that you do get yourself vaccinated when it's appropriate. And maybe Director Lyon could speak to that, because I know there is a small window where they need to wait to get the vaccine, but I'll ask Director Lyon to address that.
Thank you, County Executive. So between the doses there, depending on the product that is administered, whether it's Pfizer or Moderna, it's 21 or 28 days. We used to want to make sure that individual received that vaccine at the same location that they received their first dose. So now that is no longer the case. So you can get your first dose anywhere you would like, and then you can get your second dose at the next convenient location. You just have to take your card with you, demonstrating that the date you had your first dose and what the product was, so they can administer the appropriate second dose. And then if you happen to miss the 21 or 28 day window, meaning you've gone beyond that, you can get your second dose at any time. So I think there has been also a population that had thought, oh, I missed my second dose appointment. And there's a number of reasons. Maybe it just was, there was a conflict. Maybe they didn't feel after their first dose, so they weren't as excited to go get their second dose. So I'm encouraging anyone that had a first dose that has gone beyond their 21 to 28 days, it's never too late to get your second dose. So please do schedule that, and you can schedule it anywhere that carries the product that you're looking for. And again, you can find that at vaccine.gov. You can search by the product that you received your first dose and the locations. Thank you.
And quickly, Melissa, if you have had COVID-19, isn't there a 90-day wait until you should get that first dose?
So interestingly, we, from a public health perspective, the reason that 90-day was put into place was because vaccine was at a premium and that we only had opened it up to high-risk populations. So we were indicating to individuals that if you had been exposed to COVID and you had a positive COVID test, to wait the 90 days, and a lot of that was just to build us in some time to get more vaccine. I know a lot of physicians are still following that same clinical best practice. I wouldn't counter them on that, so if it's clinical best practice, they should continue to follow it, but that was the original reason. It doesn't have a lot to do with something will happen to you during those 90 days if you get a vaccine, if that makes sense.
Okay, thanks.
Finish up here with Erie News Now. Do you have a final question, Ethan?
A quick one for Director Lyon. Can you tell me more about the Delta variant, specifically what it could mean in our area for people who have been infected with COVID-19 but haven't been vaccinated? Could this be something where we have a lot of natural immunity right now, but the Delta variant could flip that on its head?
Yeah, that's a really great question. So what we would consider like natural immunity, or those that were either known positives or exposed to others that were positive and may have had mild symptoms or no symptoms, it's really hard to determine what that looks like for our community first and foremost, and then how protective that is. And the reason is we don't know the amount, so we do dose over time. We don't know the amount that they were exposed to, and we don't know over what period of time they were exposed. So it's hard to determine how effective their immune response will be. I anticipate that there are individuals that had a proper immune response when they were first exposed to COVID-19, and they may have some protection. I also believe there will be probably a large portion of the population that believes that they were exposed or have been a known contact or may have even tested positive that will not have a good immune response. And so therefore, we have strongly recommended, strongly encouraged anyone that even if you've been exposed and have had it confirmed with laboratory testing, to still get a vaccine, because we know that the immune response of the vaccine is efficacious, meaning that it is preventing reinfections, and it's preventing severe illness, and it's also preventing death. And then very few have been hospitalized, and if they have been hospitalized, it's been with more mild symptoms. So the short answer is your vaccine is your best product to guarantee immunity. And the Delta variant is very transmissible. It's very concerning what we're seeing in other parts of the world. So I do have some concerns. So my bottom line is, if you're able to get vaccinated and you're willing to get vaccinated, please do so. Thank you.
Thanks.
Well, thank you very much to the press. I want to end with some really great news regarding the Emergency Rental Assistance Program. This significant economic relief helps low and moderate income households at risk of experiencing homelessness or housing instability by providing rental arrears, temporary rental assistance, and utility arrears assistance. Charlie Barber from Erie County Care Management reports that there have been 1,819 applicants, with 770 households so far receiving assistance that has totaled $3.9 million to date. So we're really pleased with how well this program has been going here in Erie County in terms of the volume of applications and how quickly that Erie County Care Management is getting that funding out to those in need. If you're interested in participating in this program, please contact Erie County Care Management at eccm.org, or you can call them at 814-923-5512. And then finally, another important economic initiative to mention is the Advanced Child Tax Credit Payments for 2021. Under President Biden's American Rescue Plan, the child tax credit was increased from $3,000 for families whose children are between 6 and 17 years old to $3,600 for families with children to $3,000 for those 6 to 17 and $3,600 for those under 6. The plan allows for half of that tax cut to be paid to families in advance via a monthly check or deposit starting in July. So most families will receive these payments automatically, and for more information or to sign up, you can go to childtaxcredit.gov. So lots that we discussed today. Thank you to my great guests, Dr. Jeffers and Director Lyon, for being with me. Thank you to the media, and thank you all for joining me. I ask you all to continue to do what you can to keep our community safe. If you feel ill at all, stay home, get tested for COVID-19, continue to wash your hands frequently, wear a mask if you are not vaccinated, and get vaccinated if you are able to and willing to as soon as possible. In the meantime, please stay safe until we have our next time together. Thank you.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to yourerie.com. We now return you to your regularly scheduled programming.